Many of you know I'm a true advocate for taking supplementation to optimize your health, and one of the best things you can do is choose the right collagen. Collagen is a building block to your entire body. I was introduced to Sparkle Wellness product Skin Boost Plus about a year ago, and I've been taking it ever since. Now they've launched a new bone strength product that I'm super excited about. New Osteo Boost Collagen is formulated to improve bone mineral density, something we all need to think about as early as age 40. Made with award-winning collagen peptide known as Fortibone, the product really has led to meaningful results for people who need significant improvement in this area, including those suffering with fractures or broken bones. OsteoBoost is a great choice for anyone over the age of 40 to reduce the risk of bone mineral density loss, a major precursor to the diagnosis of bone-related diseases. Right now, you can get any of the Sparkle Wellness collagen supplements from Amazon or from their website, lovesparkle.life, and use my code DrFit for 20% off. That's DRFIT at lovesparkle.life for 20% off their new product, OsteoBoost. Welcome to the Fit and Fabulous podcast with Dr. Jaime Seaman. Hello, everybody. It's Dr. Jaime, and welcome back to the Fit and Fabulous podcast. It's so wonderful to have you here today. I have an incredible guest on today's podcast, and I'm already telling you right now, we have so much stuff to talk about that I normally end the podcast with a semen analysis. We're getting rid of it. We don't have time today. We have too many good things to talk about.
Sounds like so much fun, though.
And it is so much fun. It is so much fun. But I have a guest, Dr. Scott Sherr. Welcome to the Fit and Fabulous podcast.
Thank you, Dr. Jaime. It's a pleasure to be with you.
So Dr. Sherr is board certified in internal medicine, and he is certified to practice health optimization medicine. And he's a specialist in hyperbaric oxygen therapy. He is the founder of Home SF, the first home clinic in the United States, and is also the chief operating officer at Home USA, a nonprofit that has created a comprehensive education course for doctors and healthcare practitioners. Dr. Scott is also COO of Smarter Not Harder, which is the for-profit arm of Home and Hope, and is the company behind Transcriptions, which we'll talk about today, a line of buccal troches addressing bottlenecks along the path to optimal health. Dr. Sherr, first question, what in the heck is health optimization medicine?
Yeah, it's a good question. It's something that I learned about, I guess now it's back 2017 or so, from a colleague of mine, mentor, who actually created the program himself in his own practice after he realized that there really wasn't a focus specifically for a lot of the types of health out there. Integrative health is a very large topic. Functional health, functional medicine was more of a disease-oriented root cause illness, but who is actually taking care of the basic cell? Who is looking at like root cause health, let's call it, right? So the idea was, for him, and why I think I resonated with it so much, is that I was the son of a chiropractor. I am the son of a chiropractor, and I always thought of things as more as a balanced way of looking at things, as you looked at data, but you also looked at the health of the person in front of you and try to keep them healthy rather than just treating them when they got ill, for example, or just looking for the root cause of something. So Health Optimization Medicine is a nonprofit organization that's training doctors and practitioners on how to optimize health rather than treat disease. And the idea is to really address various types of subjects that you don't get taught in medical school or in practitioner school of any type, because they're really not sciences that are really known for disease prevention. They're really sciences that are really more focused on optimal health. And one of the major ones is called metabolomics. Metabolomics is the study of what are called metabolites, or these small molecules that are happening in real time in our cells that are allowing us to make energy, to detox well, to give us the building blocks of our proteins and for our muscle tissue and everything else. These are our macronutrients, for example. You can look at all these on the metabolomic level and understand what's happening there in real time. And so the idea is to create a metabolomic foundation for clients. It's really the foundation that everything else sits on that we can test right now. I mean, we're not really doing a lot of metabolomic testing in clinics yet, but there was an article that was written, I think it was in 2021, that called Metabolomics, the stethoscope of the 21st century. So the idea that we're really back in the 20th century, we're using the stethoscope to diagnose and palpate and all those kinds of things. But in the 21st century, where we are now, really what's coming on is that we're looking at cellular data, and we're looking at all these various streams of data, everything from your DNA to your transcriptome to your proteome to your metabolome. These are all various levels of where we can actually address and look at various analysis, and then basically put all this through AI machines eventually, and then you come up with what the UCLA guys call your narcissome, which I love. It's like basically everything about you, from your DNA all the way to the macro side, and then can give you all these predictions of your health over time. But where we are now is that we can look at the metabolomic level and truly create foundations for people. And there's various aspects. We use epigenetics and chronobiology, and the study exposomas, which is the study of toxins, bioenergetics, which is the study of your mitochondria. What else? Gut health, the gut immune system, and looking at gut metabolites and how this all works together. So my clinical practice is called health optimization medicine, and it's based on this work, obviously, and it's used as the foundation of everything I do with clients.
That is so fascinating. So to just unravel this a little bit more for people listening. So, traditional medical training, go to medical school for 4 years, go through residency, which you and I have both done. You took a pathway in, are you internal medicine certified internal medicine? So I did OBGYN, you did internal medicine. And then of course there's like integrative medicine doctors. So I went on to do a fellowship in integrative medicine. There's functional, there are naturopathic doctors, there are doctors of chiropractic. And certainly, I think that there is like this division in the world right now between Western medicine and alternative medicine. And I think there's patients that probably like have belief systems that lie, like on one side of the fence or the other. I myself am a practitioner that kind of lives with like one foot in both worlds. And it's really hard because in the traditional Western model, people look at me and they're like, oh, she's like a quack, like she's doing all this crazy stuff. And I think a lot of it is just because they don't know about this stuff. What the things that you're talking about are very, very, at the forefront of, discovering how our bodies really truly work, and is very different than traditional, treatment for most people thinking about treating this idea of health optimization versus waiting until somebody's diseased and then trying to like put Band-Aids on it and fix it. Yeah. So can you tell us, just delineate this, I guess, a little bit more? How is like what you do different than like what an integrative provider or functional provider would do?
Yeah, you're right. There's lots of different navigation that patients need to have these days as they're trying to wade through. In essence, the way I see it is that you have your acute care, which is hospitalized care. You go to the deliver babies or whatever, do C-sections, or have people that have COPD exacerbations, all that kind of thing. That's a part of the world that I live in. I still work as a part-time hospitalist, so I know that world well. And you have like primary care preventional medicine, which is basically looking for early signs of disease. And you have like functional medicine, which in general is looking for the root cause of illness. So typically a great step in the right direction, because you're not only trying to figure out how to treat something, but how do you potentially reverse it, or how to get to the bottom of it. When it comes to health optimization medicine, what we are really trying to do is to look at that foundation of your cellular health. So these are markers of metabolism, they're markers of gut health, they're markers of neurotransmitter health that don't necessarily fall into the degree where you would actually have a disease or a symptom related to them, but they are things that over time will start creating symptoms and diseases that if you catch them early, or if you focus on them even in and of themselves, even if you have a disease already, it can have a significant improvement or a significant impact on how you feel. So it's basically, the way I think about it is it purely foundational work here, because everything else lays on your ability to make energy well, to detox well, to have a gut that's working well, to have neurotransmitters that are working well. I don't care what disease or what symptom you have. And so what we talk about in health optimization medicine is setting your diseases and symptoms aside and just focusing on your foundational biology. And by doing that, you have the beneficial side effects oftentimes of a lot of those symptoms and diseases potentially being improved, mitigated, cured, whatever. We don't make any promises there. But the idea really is set all that aside and just focus on the health of the system. If you focus on the health of the system, everything else is going to get better. That's really the basics of it.
Okay, that's fascinating. Does insurance ever cover health optimization medicine, or is it totally cash pay?
Not at this point, no. We're still a relatively new organization. We're training doctors and practitioners across the world, and we're just starting over the last 3 to 4 months to really start making a push to do this. My hope over the long term is if we can really get more practitioners trained, more people doing it within their own businesses already, within their own professions, within their own practices already. So like, for example, I started as a hyperbaric physician. I was doing hyperbaric medicine, I still do, and I was working on protocols for patients and how they can optimize before, during, and after. And I realized that I really needed a foundational approach, because if people wanted to get in a hyperbaric chamber and make more energy effectively, they had to have the machinery to be able to do that. So I created a practice where health optimization medicine is the foundation of what I do, and it's integrated into the work that I do in the hyperbaric field. And I see this work in the health optimization medicine field being something that anybody can integrate into their practice as a foundational tool with whatever else they're doing, whether they're delivering babies or they're treating cancer or whatever it might be. And this is a foundational tool that will help anybody, and that's really the beauty of it. And it doesn't matter where on the spectrum of health your patients or clients are. If they're sick on the dialysis, you can do it then. Or if they're the healthiest athlete and they're running 100-meter dashes, you can still work with them then too. And I've worked with people all throughout that spectrum, and it's actually impactful no matter where people are in that world.
Okay, so a patient comes to you and you do this assessment and do testing, and tell me if I'm wrong in anything I'm saying. So this patient's got dysbiosis and they're not methylating well, and they have XYZ complaint or symptoms, because that's what patients are, that when you say like set those things aside, that's typically what they come to you for, right?
Course,
I'm having this problem and I would like this problem fixed. So what is the low-hanging fruit when it comes to, you find these problems that you need to optimize, right, for health optimization? Like, what's the low-hanging fruit when it comes to like lifestyle intervention?
Right. So the two things to say about that, at first, is that setting diseases aside and symptoms aside doesn't mean that we don't address them, right? It's just a matter of understanding when we're looking at a biochemical analysis, looking at vitamins, minerals, nutrients, and gut health and things like that, we just use that data like in a vacuum, sort of, and to say, yes, you have all these symptoms and diseases, that's okay. We're going to address those. But when we're looking at the data, we're looking at it purely from a biochemical perspective. Now, they're
not coming to you saying my mitochondria aren't working well.
Of course not. Of course not. Right. Yeah. No, they're like, I have fatigue, I have concentration problems, I can't poop or whatever it might be. Of course. I mean, and that all is very important. So we have our nonprofit organization that's training the doctors, and we have our for-profit organization, Smarter Not Harder. Transcriptions is the main company inside that makes products for focus, for relaxation, for mitochondrial health, that we use as sort of our immediate things for people right now as they're doing the harder work of optimizing their health. But like the low-hanging fruit for me, honestly, is it's data. I need data for people. I don't. There are certain things, like from a clinical perspective, that I tell everybody to think about doing, like to exercise, to not eat like shit, and to have better relationships and move their body and fast every once in a while. Like across the board, that's a good idea, right? So like if people don't want to do any testing with me, if they don't want to, and a lot of my lectures that I give over the years, like I'll try to give 5 salient points in those categories that I just mentioned, like that everybody can do very easily without spending any money or very little money. But in general, what we want to do in health optimization medicine is look at data. And like the biggest data that we use is metabolomic data, which is blood, urine, and sometimes stool if we can, to look at metabolomic markers. And the most common test that people would know would be organic acid testing, for example, which is pretty commonly done in the functional medicine world and also in the integrative world. So we use organic acid testing as sort of like the foundation of that metabolomic analysis. And then using that data, we can understand more about vitamins, minerals, nutrients, detoxification pathways, et cetera. So the low-hanging fruit for me is usually encompassing the larger program of looking at data too.
Okay, fascinating. I love that. Okay, so let's shift a little bit and talk about hyperbaric oxygen. Can you tell somebody that has no idea what it is, what is HBOT?
Yeah, so I learned about hyperbaric therapy when I was in residency. I went to the University of Maryland in Baltimore. They have a big trauma center there called shock trauma. And you'll appreciate the Q3 call, 30 hours back in medical school, and how that rolled. But every 3 nights we were up for 30 hours in the trauma center, seeing all the crazy things. And then in the basement, where there's a large hyperbaric chamber, where they were using it for something called necrotizing fasciitis and soft tissue injury. Necrotizing fasciitis is a flesh-eating bacteria, and it's nasty. People have to get their limbs chopped off. It's bad news. And so I saw people going into the chamber and having these amazing recoveries. And I asked what was happening to the technicians, because I really didn't understand. Obviously, it just looked like a submarine to me. And I learned how simple the technology was. And then my mind was kind of blown, to be honest. And I really decided to become very quickly involved in this world. And the simplicity of it is that hyperbaric therapy is really just two things. It's increased amount of oxygen that you breathe, and then increased atmospheric pressure that you're under. So we all know oxygen already. There's 21% oxygen in the air that you and I are breathing at sea level. Actually, you at sea level, me at altitude, I have about 16% oxygen here in Colorado. But in essence, there's 21% oxygen in the air that we're breathing. And that is enough oxygen to saturate almost all the sites, the binding sites on your red blood cells, the cells that carry oxygen from our lungs to the rest of the body. We need oxygen as a reminder to make energy. Without oxygen, we cannot make ATP. So we don't live very long without this. And most of us know this very well. And so anyway, your red blood cells are pretty well saturated with oxygen at sea level. If you've ever put a pulse ox on your finger, which I know, Jaime, you have many times, and to your patients, this usually will measure 97 to 100% on most people. This is the number of binding sites that are bound with oxygen at 21% oxygen in the air. So the question is, how can you really increase your oxygen carrying capacity if you already have that many bound sites? There's a couple different ways you can do it. You can increase the number of red blood cells you have in circulation. So you can come visit me here in Colorado, spend a couple months, and you will increase the number of red blood cells that are in circulation because you have a hormone that gets released called epigen. Now, you can also just take that hormone as well. And this is what cyclists and other performance athletes were doing and probably still do to increase the number of red blood cells in circulation. You can also give yourself a red blood cell transfusion. You can give yourself a number of red blood cells right before you have a race or you have an event and you want to have more oxygen carrying capacity. There's another way, though, and that's by increasing your atmospheric pressure. And this is where hyperbaric therapy comes in, because when you increase the pressure on a gas, the more pressure you put on that gas, the more it's going to go from a gaseous form to a liquid form. So basically, you get more liquid O2, the more pressure you put on the body. And pressure is increased atmospheric pressure. The best way to think about this is that if you've ever been underwater, which all of us have, all the water above you is exerting a pressure on you. You don't feel it because you're weightless in the water, but that water is actually very, very heavy. And that pressure we simulate in a hyperbaric environment. And that pressure combined with increased oxygen drives more oxygen in circulation. So that increased pressure is driving oxygen not only on those red blood cells, but also in the liquid of your bloodstream or the plasma. And you can get up to 1,200% more oxygen in your bloodstream by using hyperbaric oxygen therapy. And at 66 feet of seawater equivalent pressure, you don't need red blood cells anymore to carry out all your physiologic needs because you can saturate so much oxygen in the body, in the plasma, without there even being any red blood cells available. So that's the long story short of what's happening in a hyperbaric chamber. You're getting a lot more oxygen circulation. You're doing it because of the pressure that's being exerted on your body. So your whole body needs to be in the chamber for this to happen. Sometimes I get asked if you can like put your arm in your leg or whatever. You have to be breathing in the oxygen and pressurizing it that way for it to work.
Yes, I'm very claustrophobic. So HBOT has always been like a fear for me, but we're starting to see like more places, pop up where people can just walk in and get HBOT. So if you don't have necrotizing fasciitis or some kind of wound or something that you're trying to heal, who would be the person that would benefit from an HBOT program?
So there's 14 indications that are covered by insurance: diabetic foot ulcers, radiation injury from cancer treatment, sudden hearing loss, flaps and grafts and plastic surgery, and osteomyelitis, so chronic bone infections. Those are the most common ones. So like if you go to a hyperbaric facility around the country, in a hospital, they'll usually be covering most of the insurance-related indications. But where I spend most of my time is in what we call the investigational world. And this is actually how I got involved in the performance optimization space back in 2013, 2014-ish, that time frame. I started getting more involved in the optimal performance world of hyperbaric therapy and how it can be used to basically accelerate healing, optimization, recovery. And it's done in various ways depending on what people need. There's also different types of chambers. There are mild units, there are soft-sided chambers that you can have for your house. And there's also the medical grade units that you go to a facility for typically, although some people have the medical grade facility medical grade chambers in their homes now too, that go to 2 atmospheres. But the idea is that, I often say this, Jamie, it's not if hyperbaric therapy is going to be helpful, it's when, because everybody really can benefit from it at some point. The question just becomes, when is the best time for you, depending on what's going on. Now, from a claustrophobia perspective, we do have very nice chambers these days that are very large and translucent and easy to see from all angles. But if you have super bad claustrophobia, it can still be challenging. We have drugs for that, things like Xanax, of course, and Ativan, but also things like Trocalm from my company also can work as well to help calm people down before surgeries and procedures and things like that. But in essence, what it comes down to is you have to think about hyperbaric therapy as this fantastic accelerating healing and recovery tool. And then it falls into two buckets. The first bucket is there an acute need to get into this chamber right now because you've had an acute injury, acute trauma, acute surgery. So you've just had surgery, for example, you've had ACL tear, you've had plastic surgery, you've acute injury, something acute. We know hyperbaric therapy is going to heal the body faster. You're going to accelerate healing anywhere between 20 and 70% faster. So they've done it on terrible things like acute traumatic brain injuries, spinal cord injuries, heart attacks, strokes. Like there's a good data here that hyperbaric therapy is going to help you heal faster and maybe not die if you've gotten those things, which is kind of awesome. But in general, for like the average person that has an acute issue, they're going to get the surgery, they're going to have the injury, then they're going to see about 20 to 70% faster healing as a result of getting into the chamber. But if you fall into the other bucket, which is you have a chronic issue, you have a long-term goal, then oftentimes, and I've gotten in trouble in the hyperbaric world for saying this, it's not time to go into the hyperbaric chamber right away. It's time to understand a more holistic approach as to how we're truly going to help these people. And that's really where health optimization medicine came in for me. That's the foundation of my work that I do with patients that come in for more of a chronic indication. Say they have chronic Lyme disease, or they have early onset dementia, or they have reflex sympathetic dystrophy, the RSD, they have a chronic pain syndrome, or they want to reverse their age, even if they're looking to optimize and reverse their age. These people do much better if you look at more of a holistic approach, where you're looking at what I say is a before, during, and after approach. So what are you doing before hyperbaric therapy? What are you doing during, like immediately before or even inside the chamber? And what are you doing after the hyperbaric chamber experience to truly give you a holistic approach so that you really have a much better chance and not only helping yourself now, but having a sustainable benefit over the long term is what it comes down to.
So if you don't have an injury or a chronic illness, is there any benefit to getting in there?
So the answer is yes. Yeah. And this is where it comes on the optimization side of things. And so, but everybody's got something to some degree is what it comes down to, in the sense that like,
oh no, I'm perfect. I'm perfect.
I'm perfect too. I have a home unit in my house, but I don't use it because I'm perfect. No, but I actually
have a black eye right now.
Oh no, what did you do? Was it boxing?
PRP. Nice. Yeah, they got a little close to my blood vessel. Apparently.
Yeah, it happens. Yeah. So what I think about here is that on the optimization side, hyperbaric therapy is just a fantastic tool because it's helping decrease inflammation. It's getting more oxygen to the tissue. And so as a result of that, you're getting an environment where the body's able to heal better and to be more resilient is what it comes down to. And so we have good studies that even a short period of hyperbaric therapy is going to help with cognitive improvements. It's going to help your brain function faster. It's going to help you recover faster from exercise, from your PRP in your face. It's going to help do all these various things that we need on a day-to-day basis. Because in essence, what hyperbaric therapy is doing is it's number one, it's reversing low oxygen states. Okay, so it's doing that immediately by getting more oxygen to the body, but over the long term, it's actually creating new blood vessels. So it's creating angiogenesis, new blood vessels in areas that may have been damaged, deteriorated, inflamed, et cetera. The third thing it's doing is it's decreasing inflammation and swelling. So this is extremely important. If you've had a head injury and you have head swelling, like you want that swelling to go down. But over the long term, it's also decreasing inflammation by decreasing and downregulating these various inflammatory factors like interleukins and TNF alpha and things like that are responsible for inflammation. So it's downregulating all those. And then it's also releasing stem cells. It's doing that immediately. And over the long term, the stem cells get matured into the various types of stem cells that are required to help that tissue heal. So there's, again, the acute exposure, then the long-term benefit. And that long-term benefit is all related to epigenetics and how Hyperbaric therapy is transitioning or shifting the expression of various genes on your DNA to help you optimize healing, is what it comes down to.
What is the typical protocol as far as like how many sessions and how long?
It depends. So if it's more of an acute indication, it's typically not that many sessions that you need to see a significant shift in that accelerated healing process. So 2 to 5 sessions, maybe 10 sessions you might see. And then if it's more of a long-term thing, like a long-term goal, like reversing your age, or if it's for something that's a chronic illness, then you're talking anywhere between 30 to 60 sessions in the chamber. And these are typically done 5 days a week, Monday through Friday, with weekends off. The time in the chamber can be anywhere between 60 to 120 minutes, depending on the indication. And then there's different types of chambers. There's the mild units where you have less pressure, less oxygen. These are more focused on neurocognitive optimization and also just general day-to-day optimization, muscle recovery, minor injuries, those things like that. The deeper chambers, the ones that go to 2 atmospheres, which is the equivalent of about 33 feet of seawater pressure. That's where we have most of our data for recovery, for illness, for injury, those kinds of things. So it really kind of depends on looking at the type of chamber that you need, the length of the chamber that you need, the time in the chamber, and then those are the major things that you're thinking about when you're looking at the types of protocols that people would benefit from.
Awesome. Awesome. Okay. So let's pivot a little bit and tell me a little bit about transcriptions. That's actually how I found you.
Yeah.
And ordered my first product, tried it out, but tell people what transcriptions is.
Yeah, so it might sound a little schizophrenic to people as they hear me talking about all these different things, but I think transcriptions is it's an amazing company, and I'm so proud of what we've been able to accomplish. We have what are called buccal troches. We make precision dosed pharmaceutical grade and physician formulated. There's 4 docs on the team, including me, and transcriptions was founded as a result of the work that we were doing in health optimization medicine and practice. The nonprofit organization, training doctors and practitioners, we knew that finding ways and then creating a framework for people, for clinicians to use in their practices to optimize health in their patients, it takes time. It's not something that immediately people feel better right away. It'll take time. And as a result of it taking time, you really need to have things for people right now that they can use to feel better right now. So transcriptions was born with this in mind. How can we make people feel better right now to the major things that they need as they're truly optimizing their health and their performance? So the word transcriptions, or the company transcriptions, the name itself comes from 2 words. The first is troche, and the second is prescription. So troches are these what are called buccal troches. They're these dissolvable lozenges that dissolve over about 15 to 30 minutes in your mouth, usually between your upper cheek and your gums. And the second word, scriptions or transcriptions, it comes from the word prescription. So we are as pharmaceutical grade, as close to a prescription as possible. So we wanted to be able to use these things in our clinical practice, basically. And so the clinical practice that I use these products all the time, and I use them in the context of optimizing health, if I can, for most of the people that I work with. So transcriptions was born as a for-profit arm of our nonprofit organization to help people right now. And we have 3 products. We have one that's called Nicotine. This is our product for focus, concentration, getting things done. Nicotine has 4 ingredients. It has methylene blue, it has CBD, it has nicotine and caffeine. And so low dose nicotine, low dose caffeine, all pharmaceutical grade, all made in a way to truly just launch your performance, productivity, and focus, because we all need this sometimes. And then we have our Just Blue product, which is pure methylene blue. Methylene blue itself is a fantastic mitochondrial optimizer. It helps with energy production. It increases resilience. I think this is the one you take, Jaime, right? You take Just Blue, I think, right?
Yeah, no, I've tried Nicotine as well.
Oh, okay, you've tried them both. Okay. And I'm happy to talk more about methylene blue, but methylene blue is one of these amazing compounds that's been around forever that has all these qualities to it. But in essence, what we use it for mostly at Transcriptions is a health optimization nootropic, a way to help with brain function. Wherever you have mitochondria, that's where methylene blue is going to go. And it helps with cycling of energy, creating more energy, and also helping you neutralize any potential oxidative stress from making energy as well. So it's got this resilience piece to it at the same time as building energy. So we have our pure methylene blue troche, just blue. And then we have TroCalm, which is our relaxation, stress reduction, unwinding, take the edge off troche, which has a combination of kava, CBD, CBG, which are both non-psychoactive cannabinoids, as well as something called B3 GABA, a very highly blood-brain barrier permeable type of GABA, because most GABA supplements do not, their bioavailability is basically zero because they don't go across the blood-brain barrier by themselves. So that's the suite of the things that we have now. And that's what we're doing, is really trying to use these for people that need these things now, more focus, more relaxation, more energy right now while they're doing the harder work of optimizing.
So for people listening, a buccal troche is basically this like tiny little waxy cube, and you basically put it inside your mouth, like in between your cheek and your gum or under your tongue. And you don't want to be, you know, like you don't want to swallow it. Yeah. You want to let it just sit there. And then correct me if I'm wrong. Basically the substance is then absorbed through the mucosa in the mouth, which is why you don't want to be swallowing it. But I noticed, like, when I've put it there, I start salivating more.
You do. The key is to put it as far back as possible and to limit salivation if you can. I mean, of course, you're going to swallow some of the ingredients, but the reason why we use the buccal troche is because it directly infuses into the brain circulation, into the vascular circulation of the face and the brain. And so what happens when we swallow supplements or we digest our food, it doesn't matter, or capsules, if they're supplements, it has to go through what's called liver digestion, or first pass metabolism. So it goes into your stomach and your small intestine, it gets absorbed, and then it goes through your liver. And then most of the time, the bioavailability, or the amount of that supplement or compound, is going to go down dramatically. The nice thing about a buccal troche is that it prevents that from happening. It goes directly into circulation that way. The good news about methylene blue, though, actually, is that methylene blue is bioavailable almost 100% no matter how you take it, whether you take it buccally or whether you swallow it. So I get this question a lot because some people don't want to have a blue mouth, and that's cool, I understand. But what happens in the buccal form is that it does work faster that way. So people that have brain fog, they have concentration issues, they have fatigue, I find that it works better to have it in their mouth if they can. If it's more like muscle fatigue and more sort of systemic, then swallowing it can also be just as helpful. I mean, we know that the most mitochondria per cell are in your muscle tissue anyway. So you need a lot of energy being produced in your muscles to continue to make energy and do the work that we want to do if you're doing workouts and things. So I was actually on a podcast with Dr. Gabrielle Lyons, and make sure she was very clear. Most mitochondria in our muscles, and that's true. But we also have a lot of mitochondria in our heart, in our liver, and in our brain, of course, right? So,
and there's a crap ton of mitochondria in our eggs. In our ovaries.
Eggs, and also in sperm too, of course, right? Yeah. And so it's really important to have optimized mitochondrial function if you're going to feel well in general, if you're going to be able to procreate, if you're going to be able to think, if you're going to be able to move. I mean, all these things. And we know that our brains they get about 20% of our blood volume at any one time. And so if our mitochondria are not working well in our brain, this is why we get brain fog. This is why we get fatigue. This is why we get concentration problems. And so certainly, there's some models now of looking at Alzheimer's disease as a blood flow issue and using methylene blue as a way to mitigate or reverse this potentially as well. So, excuse me, I've had a lot of patients in my own clinical practice, because my clinical practice, as I've mentioned, it's health optimization medicine as its framework, hyperbaric oxygen therapy as my technical tool of optimization, of like accelerating and really making healing happen and recovery. And then I have the transcriptions company products that I use to help within that whole context. So as we were alluding to before, I use TroCalm for people that have a hard time getting into the chamber because they're claustrophobic, or they have a lot of anxiousness, or they have a lot of stress, and it's much better than alcohol or something else, for example. And then I use Just Blue as a way to help people. The main thing there is that when you're looking at energy production, it's also going to cause stress on the system. So you want some stress on the system, but you don't want too much stress, especially if the system's already stressed. And so Just Blue is a great way to help mitigate some of the stress that people may have because of being in the hyperbaric chamber. So that's some of the ways that I use them in clinical practice, but it always comes back to me to that framework, is how am I using this with patients?
So you brought up something interesting as, you said, like, if you want to avoid alcohol. So I I've been sober in my life, obviously, during my pregnancies. I gave up alcohol when I did my first bodybuilding competition this last year. And then most recently, I've initiated this Hard to Kill 365 challenge for a lot of my followers where I'm giving up alcohol for a year. And
Mhm.
for me, it was like I really wanted to do it for 365 days because I wanted to experience every single time of the year, every birthday, every holiday, every whatever that I may have used as an excuse to just,
Mhm.
have a few drinks. And I never really had a problem with alcohol, but I just noticed that with each year of my life that went by, my resilience to like having a few cocktails was just like less and less and less. And I'm at a point in my life where I need to be on all the time. I mean, I'm basically on call 365 days a year to deliver babies and things like that. And I just felt like I want to see what life is like without it.
Mhm.
Well, I'm at a point now. I gave it up October 1st. I'm doing this for a whole year, but I'm at a point now where I don't know that I ever want it back.
Mhm.
But, I keep joking. I'm like, I'm going to need a new drug because I do like the
The wind down,
relaxation.
relaxation.
I
Yeah.
like, right. But I don't like any of the other effects. And so I've really kind of been diving into this world of like nootropics. And of course, as soon as you purchase one sort of like little nootropic beverage. So I'm drinking some exogenous ketones right here because I do that when I podcast.
Nice.
But as soon as you purchase one nootropic drink off like Facebook or Instagram, now all of my ads are like these different nootropic drinks. And so can you tell people, you've kind of explained some of the ingredients and some of
Mhm.
the troches, but like, what is the difference between a psychedelic and a nootropic? Because like when I say I need a new drug, like I'm not interested in doing like any illegal substance, but you know, just something that makes my mind feel different.
Yeah, there's a big topics. I mean, in general, nootropics fall into a couple different categories. In essence, a nootropic is anything that enhances your brain function. So it's a pretty broad category. One of the things that we did, so Dr. Ted Achacoso, who's the founder of Health Optimization Medicine, as well as Transcriptions, he's the pioneer of both, actually. He, in the beginning, when we were talking about this company, and we came out with Blucanatine, which is our focus, get shit done, flow, energy, productivity, 3 to 5 hours. Like it works like a classic nootropic, like your Adderalls of the world kind of thing. Like it works like that. And except it doesn't have all those potential side effects. And don't stop any of your drugs, ladies and gentlemen. This is not medical advice. But in general, what we wanted to do is we needed to reclassify what nootropics actually were, because it's a category that spans a huge number of substances, right? So the way I think about this and the way we think about this at my company is that we have something called health optimization nootropics, and we have performance optimization nootropics, okay? Health optimization nootropics are ones that support the system, that do not clock the system. So they're healthy for the brain, is what it comes down to. And then performance optimization nootropics are ones that are specifically used to perform a certain task better. So this is like your caffeines, your nicotines, your paracetams, your Adderalls of the world, because these are the ones that are making your brain better to perform a task, but are not necessarily healthy for the brain. Okay. And so then you have those two categories. And so what is a good health optimization nootropic? Actually, something like tyrosine could be a good health optimization nootropic because it's giving you the amino acid, it's an amino acid that builds your neurotransmitters that are helpful for stress response, your dopamine as well as norepinephrine, right? Also, something like CBD is also a health optimization nootropic because it's supporting the system. It's increasing the level of something called anandamide in your brain, which is your bliss neurotransmitter, making you feel better. It's giving you more neuroprotection, et cetera. Then you have on the other side, you have performance enhancing nootropics. This is something like our Blucanatine because it has nicotine and caffeine in it. Caffeine is a performance enhancing nootropic. You have the paracetam family, and you have others in this category like nicotine as well. And nicotine also, like nicotine and caffeine, both stimulate the system to work harder. And so that's the first thing to think about is, am I taking something that's supporting me, or am I taking something that's also going to enhance me, but it's also going to help me perform a task, but it may not be healthy for the brain. So I think that's helpful for people to think about. And then when you think about psychedelics, they can fall into both of these categories. But there's different types of psychedelics. There's like your classic psychedelics that are given at high doses that cause state changes and mental status changes, as we'd say in the medical world. And you have other ones that are in the non-classic ones that may not cause those changes. But in essence, what we're looking at here, not so much as that part of it, is what's happening on the neurogenic side, what's happening in the brain. So we know that some of these psychedelics, like psilocybin, for example, LSD, and even DMT, have potential therapeutic benefits from a nootropic perspective as well. But they're not always being used in this way, of course. They're being used for the state change piece. So you ask a complicated question because psychedelics do fall into the categories on both sides and can be nootropics. But if they're used in a context where that's really where the goal is. So for example, ketamine-assisted psychotherapy is a way to use a psychedelic in a way that's helping with brain retraining, right? Because you're going through therapy to help your brain train in a different way, or the way your body or your brain is reacting to various types of stress or trauma, for example. So short story is that nootropics are a large category, and like a lot of these compounds can fall in the different aspects of these, and you just kind of have to know what you're getting into before you get into, and then decide, is that where I want to go? That's where I would say.
Okay, so in the blue canatine, you have nicotine, and I'm sure there's somebody listening that's like, whoa, like that's what's in cigarettes, like that's bad. So is it in the dosage? Can you talk a little bit more about the benefits of nicotine as a nootropic?
Yeah, nicotine is a fantastic nootropic. The problem is that people vape it and smoke it, because when you vape it and smoke nicotine, it gets directly into the bloodstream very fast. And also it includes all the other things that are in the vaping and smoking products, all the additives and the other things that have been bred into the tobacco plant to make it more addictive over time. And so nicotine by itself, though, if it's given in a slow release type of form, so we use, again, the buccal troche that releases over about 15 to 30 minutes, and it's pure nicotine, 1 milligram of pure pharmaceutical grade nicotine. It's a very low dose as compared to a cigarette or a vaping product, which is anywhere between like 8 to 30 milligrams of nicotine per cigarette or per vaping. I don't even know how they classify the vaping thing. The vaping has a lot of nicotine in it with the additives as well. But in the buccal troches that we use, we have 1 milligram, so very low dose, and it's being used in the buccal form, so 15 to 30 minutes absorption, so not immediate. And so what nicotine does is it releases a number of neurotransmitters in the brain that help you with focus, concentration, mood elevation, so norepinephrine, dopamine, and serotonin. But it does this, if you do it over a slow 15 to 30 minute period of time, you're still going to feel amazing because your cognition is going to go up, your recall is going to go up, your memory is going to go up, your verbal fluidity is going to go up as well. And so those are the things that nicotine is very well researched in doing, and it's actually being studied and has been studied in older populations, in Alzheimer's disease, in patients with mild cognitive impairment to help with brain function. So it doesn't have to be scary if it's done at low dose, if it's done with a slow release type of formulation, and it's not vaped or smoked. But I certainly understand why people get scared about it.
So how many of these blue canatine per day would be appropriate?
So the cool thing about how we formulate things, Jamie, is that it's all very low dose. So 1 milligram of nicotine, 50 milligrams of caffeine, which is 1/4 cup of coffee, 5 milligrams of CBD, and 5 milligrams of methylene blue. So it's very low dose. Most people's average dose for our troches is 1/2 of that. The amount you can take in a day would be 4 is the limit. You could take a total of 4 full troches, but I haven't met one person yet that actually needs that many. Typically, it's a half is all people need for about 4 to 6 hours or 3 to 5 hours really of focus, concentration, and getting shit done. Now, some people with a lot more lean body mass will need more, like a full troche, or if they drink a lot of caffeine every day, a full troche might be what they need, but typically not more than 1, maybe 2 per day if you're having a really big day. But in general, the nice thing about having methylene blue in there as well is that it's supportive, and CBD as well. So they fall into the categories, as I was discussing before, of health optimization nootropics. So they're supporting the system at the same time. In fact, we came up with a new category for methylene blue specifically because it has 2 qualities. It has the quality of supporting and keeping the brain healthy. At the same time, it's also releasing neurotransmitters. It works as a mild monoamine oxidase inhibitor, which basically means it helps with norepinephrine, serotonin, and dopamine release too. So it's giving a little bit of a clocking of the system or performance piece. So it's got both. So we call it a blue tropic. That's what we call methylene blue. But anyway, so I hope that answers your question. So.
Okay, so yeah, on methylene blue for a minute. Of course, in medicine, the only time I've ever used methylene blue is I used to give it IV so that we could see the ureters during hysterectomy, so that we can see the ureteral flux in the bladder. But then we couldn't find it. Like now you can't find it anymore. We have to use like pyridium and other substances. So which I don't know who's stock, but maybe it's transcriptions. It's
Maybe
stockpiling
it's
all the
us.
methylene
Sorry.
blue.
Yeah. No, we definitely did start a trend though. I'll tell you that.
But talk again about the benefits of methylene blue and the dosing, because I want people to understand the nuance here.
Yeah, so methylene blue, like you said, has been around for a long time, and it's used in surgical practice still. I didn't realize it was in short supply for you guys. My friend that's a transplant surgeon uses it to look at the bladder to make sure they didn't nick the bladder after they've done kidney transplants and things like that. So I know it's being used in those ways, but methylene blue started off as a treatment for malaria, actually, back in the 1890s. Somehow it initially went from a dye for blue jeans. So it was a chemical dye. It was a dye that was used in industrial manufacturing. It's a synthetic ingredient. It's not natural, just so people know. And it went from there to treating malaria somehow. And it was the first anti-infective that we really had before antimicrobials came about in the 1950s. And it was used for urinary tract infections because methylene blue actually concentrates in the urine. So if you take it, doesn't matter if you have it IV orally, it's going to concentrate in your urine. You will have blue pee. So heads up, blue pee. And so they used it for urinary tract infections, but they were also using it in antifungal, the anti-malarial, as an antibacterial. But it fell out of favor in the 1950s when antimicrobials came around because people didn't want to take methylene blue and have their secretions turn blue, basically. And so, and about 50 years or so, sorry about that, 50 years or so after it became less as an antimicrobial, we really understood that it had a number of other qualities, including as a potential antipsychotic. And so it was used as the derivations of methylene blue were the first antipsychotics, actually. Something called chlorpromazine was actually derived from some studies they did from methylene blue back in the 1950s. It's also a cellular stain. So it was actually used as to stain mitochondria. And that's how we started realizing that, wow, what was actually happening with methylene blue in the mitochondria is that it was increasing energy production on the electron transport chain in the mitochondria, and also helping with detoxification or neutralizing oxidative stress in the mitochondria at the same time. But the dose was key, right? So the dose is really important. And so when we decided to make this as a nootropic, as a mitochondrial optimizer, we stayed at the very low dose of the range, because the very low dose of the range is where we know it's a mitochondrial optimizer. As you get to be a higher dose, greater than 1 milligram per kilogram overall, that's when you start getting more of the anti-infective capacity for it. But that's when you also start potentially getting downsides to long-term use, including things like issues with your gut microbiota, gastric ulcers, and also because of the half-life, how long the methylene blue stays in the body, you can get issues with it building up in the system over time. So our dosing is very low dose, less than 1 milligram per kilogram. And it's a dosing that's being studied right now for Alzheimer's and mild cognitive impairment, although we make no claims, of course. But that's really where we were really focusing our dosing when we made our products. You'll see other methylene blue products on the market now. Since 2020, when we released this, there's at least 10 other companies that are making this now. We were the first. We came out because we had a huge ask by our users that didn't want nicotine and caffeine in their products, and also were worried about a certain virus that was going around at the time. And there is some data there too, which is very interesting as well, especially in sort of the post-viral world now, using these things as a way to help with mitochondrial function, right? That's really what Just Blue and with methylene blue is doing in general. So the dosing is really important. So I appreciate you bringing it up. And typically I have people start off at about a half of our methylene, or of our Just Blue, or of our pure methylene blue troche, and kind of titrate it from there. Although they may not feel something right away, if they do have brain fog, if they do have ongoing inflammation, oftentimes they will feel it pretty quickly.
So a full troche is 5 milligrams.
A full troche of the Just Blue, of our pure methylene blue troche, is 16 milligrams.
Okay, 16 milligrams. But you were saying there's 5 milligrams in the blue canatine?
Yes, exactly. So we use it more of a supportive there, and it's a more of it's a higher dose in the Just Blue. And I've had people tell me that they've taken higher doses but felt more with ours than they have with the higher dosing. And I think that's because we're using a pure pharmaceutical grade source. We're not taking it from the hospitals, I promise. But but we're using a source that we vet from end to end. So we get it from a manufacturer that test it themselves, that's third party tested, and then we test it ourselves again when we get it to make sure that it's pure pharmaceutical grade stuff, because that's the challenge. We just don't have, it's hard to find good USP grade methylene blue. And oftentimes it's coming in droppers and liquid, which is really difficult for people to titrate. So the troches make it very easy. And, I think of our methylene blue truly as something that you can use as a daily health optimization supplement or a formula. That's how I use it mostly. I have probably a half a day, and then when I'm traveling, I have jet lag protocols that we talk about with my patients, and that we talk about on Instagram and things like that. We have jet lag protocols, we have viral protocols, we have fatigue protocols. We're working all those kinds of things, health optimization protocols, et cetera. Because I do feel like it's something that, even though it's not something from nature, that is true, that most of us do require, given the kinds of worlds and the kinds of lives that we live these days.
Fascinating. Okay, so if somebody is just going to go to the website, go to transcriptions, or looking at methylene blue or blue canatine or trocalm or whatever,
Yeah.
You've got some recommendations for like starting dosages to try it out and those types of things.
Absolutely. I mean, the way the troche is made, it's scored, which means that you can cut it up into 1/4, 1/2, or a full, or even 3/4 if that's what you want to do.
Yeah.
And you can take it slow. I mean, for most people, it depends, depending on kind of where they're starting. I usually half of a dose is typically where people will, on average, like to be. If you're really sensitive to caffeine, for example, if you're getting blue canatine, you want the focus, you want the concentration, but you don't want the jitters, then starting with 1/4 is the way to go. If you're looking at trocalm, for example, trocalm is great because a full dose is really relaxing. But like 1/4, if you're just having a lot of stress, is going to take you down just enough so that your brain's going to start turning on again. So if I get nervous for a podcast, I wasn't nervous for yours, Jamie, but or nervous for like a speaking event, like I'll take like 1/4 or even maybe an 1/8 of trocalm, because just a little bit of that is just going to take the edge off just a little bit, so that my brain, instead of being so sympathetically dominant, is going to just relax a little bit and get a little more parasympathetic, and then I'm just going to be able to function better. So we have people that use it for performance related tasks, and we also have it for people that can't fall asleep at night because their brain is just turning and turning and turning. It quiets your mind. If you have a quiet mind, feel more relaxed. It's kind of like those 2 glasses of alcohol effect. Without you don't get the euphoria of alcohol. So that's the other thing. Alcohol gives you like a little bit of that euphoric kind of thing, but it does give you the relaxation piece of not drinking alcohol. And I resonate with what you said before with alcohol, Jamie. I don't drink anymore. I don't see any reason to, but the resilience to these things as we get older, even if we're optimized, is still not going to be as great. And so I don't see a reason to drink. Maybe it's because I'm boring. I'm married. I have 4 kids. I don't go out anymore, but whatever.
That could be too. I've got 3 kids, like 9 full-time jobs.
Maybe that's, I just don't have time. But like the problem with you and I, it's like, you don't have any time, like you said, to have like sit around in front of a TV and watch Friends episodes. Like, I don't have time for that.
I don't watch any TV. Like now, like people are like, "Oh, have you seen Yellowstone?" I'm like, "No." Not
yeah, no, my downtime is in my infrared sauna at night, reading and meditating. Right. So I'm with you. So I feel it. So I think it's a great alternative for things that would potentially just trash your sleep, like obviously like alcohol. And so, yeah, everything comes with directions on our site. It's very easy to follow. We have a lot of great information on our blog. Most of the initial articles I wrote all by myself for the most part, so that I knew that the data and the information was exactly, I hope, what people need and want, like the full methylene blue history, which is super cool. We went through some of it here, but also some of the other aspects of our products and all the ingredients. And we have some really novel things in there. But again, the key always is like, it's not a product that's going to fix you. It's about fixing the foundational things. That's what health optimization medicine is all about. And then on top of that, using trocalm to help you sleep, using blue canatine to help you focus, using just blue to help your mitochondria so your brain fog is better post-viral stuff or whatever, right? We have all these sort of things, all these ways that you can feel better now as you do the harder work of optimizing. And then, of course, getting people into the hyperbaric chamber is a part of what I do on a regular basis, and work with clinics all over the country, all over the world, to help figure out protocols to use hyperbaric therapy. But using all these tools, again, it's hard. People think I'm schizophrenic, but it all makes sense to me because it's all part of what I do in clinical practice. Because that, in the end, like you and I are seeing patients all the time, right? And we see what happens on a day-to-day basis with these people. So I think that's the most important thing I hope that I can relay, is that all this comes from clinical practice. I'm doing this stuff every day, either myself or with my patients. And I'm using our troches, using the chambers, using health optimization medicine. And so, and that's kind of the nature of the clinical world that I live in.
Okay, one last question for you, and then I want you to tell people where they can work
Sure.
with you. What is your diet like?
My diet, it's more, I would say it depends typically, but right now I'm more of in like a bit of more of a building phase. I've been playing around with some new machines and new technology. So I'm definitely much higher on the protein side, higher protein, moderate fat, like lower carbohydrates. Although I tend to do like a lot of my carbohydrates near exercise for our insulin sensitivity and things like
I
that.
love it.
But yeah, but I change over time. It depends. My kids, just for people know, like that, they eat cereal, they have pizza, all that kind of shit. Like I don't have that stuff, but they do. Yeah, sometimes I will, but very rarely. But in general, my diet's pretty clean overall. Yeah.
I love it. I'm in a building phase too. Okay, so tell people how they can be your patient and how they can find prescriptions.
Yeah. So for me, I do a lot of clinical work remotely, most of it remotely these days. And I work with hyperbaric clinics all over the world, though. So if you were interested in hyperbaric therapy and you wanted to learn about the best protocol for you, I would be happy to help you do that. I know a lot of the facilities in the US. So the best place to find me is probably my personal website is drscottsherr.com. Just my name, drscottsherr.com. That's going to head you over to my hyperbaric world. If you're interested on the health optimization medicine side and that foundational work, you can also get me there. There's also my Instagram at Dr. Scott Sherr. Again, my name, drscottsherr. That's where I am on Instagram. And then Transcriptions is at transcriptions.com and also on Instagram at transcriptions. If you're interested in the website as well for our nonprofit organization, that is Health Optimization Medicine in Practice. homehope.org is the website for short. And we're looking for practitioners that are really looking to find ways to optimize the health of their patients, have a telemedicine practice. You don't have to see people in person if you don't want to, have a cash paying part of your business if that's what you're interested in doing, and looking at foundational ways of optimizing. So those are the many places you can find me.
I love it. Okay, so does the methylene blue ever stain?
It will stain only if you have plastic in your mouth. So if you have Invisalign, please don't use methylene blue in your mouth. Yeah.
I already did it.
Oh no, you did.
I
Oh
just
no.
finished my Invisalign and I didn't have it in with the Invisalign, but I clearly obviously still had it in my saliva. But thankfully my Invisalign trays, they get ditched every week or whatever.
Okay,
So now
gotcha. Yeah.
so now I just make sure like before I put my retainers in, obviously like I brush anyway. So, but yeah, I
Yeah.
totally stained an Invisalign tray with
Yeah,
it.
so watch your Invisalign. If you have porcelain teeth, you're okay. If you have porcelain crowns, you're fine. If you have plastic crowns, or if you, for whatever reason, some of the temporary crowns, they will stain blue. So, and there are people that just want to swallow, and that's okay. Swallowing methylene blue is perfectly fine. Blue carnitine and trocom are much better if they're dissolved in their mouth. They're going to work faster.
Yeah.
They're going to work more effectively that way, but they still work if you swallow them too, which is not as significant as what I've found over the years. So.
Awesome. Awesome. Well, Scott, this has been wonderful. We could have like 3 more episodes on all of this. And
Yeah, it's a whirlwind. Thanks, Jamie. Yeah.
I'm gonna have to try out. I'm gonna have to try out the Trocalm. I think I probably need it to get in my HBOT chamber, but I probably don't need it for any other
Maybe
time.
Maybe at night, relaxing when you're thinking about like your alcohol alternative, you could think about trying the Trocalm and see how you feel. It really is a nice way to kind of just wind down. That's how I use it typically, and a lot of my clients will use it that way too.
I love it. I love it. Well, thank you guys for listening, and make sure you share this episode with all your friends and family because somebody is going to find it interesting. And I'm telling you, I think that Dr. Sherr is onto something. I think this health optimization medicine really is the future. So we'll catch you guys on the next episode. Did you guys love that last episode of the Fit and Fabulous podcast? Well, of course you did. And I want to keep bringing you the most amazing content from the most incredible people. And you can help me by subscribing to the Dr. Fit and Fabulous channel. You guys know where the button is. Just click it. It's the doctor's orders.